Now, WaterAid Uganda, a non-governmental organization dedicated to improving access to clean water, sanitation and hygiene WASH, has launched its annual influence plan. This significant initiative aims to bolster the nation's WASH services, particularly in health facilities, in collaboration with the Ministry of Health. Sudat Kaye reports.
WaterAid Uganda's partnership with the Ministry of Health highlights their joint efforts in enhancing WASH services across the country. This collaboration has already borne fruit with the development of a micro-planning handbook for WASH in health facilities and contributions to the national environmental health strategies.
I also want to reiterate that the Ministry of Health is really committed to collaborate with WaterAid and develop policies and plans in this partnership. And also, what you are doing is actually in the NRM manifesto. NRM is the party in power, and it had a manifesto to fulfill the Sustainable Development Goals, and part of this, you are already doing it.
One of the pressing issues addressed during the launch was the high rate of open defecation in Uganda, currently at 16%.
The contingency plan is one of that most important ingredient in a WASH resilient, a climate resilient WASH system for a country. So we need those contingency plans, those plan Bs, for those places that we can map out and know that for sure when drought comes or when there are mudslides, these places are prone. Kasese is one of them, Bududa is one of them, areas of Karamoja that face a drought are one of them, so there should be contingency plans.
Changing community behaviors towards water conservation was also highlighted, urging people to harvest rainwater instead of relying solely on wells.
Previously, we used to know, for instance, that mosquitoes usually happen during the maize, mango time, isn't it? So they would say, oh, the maize and mangoes are causing what? Malaria. But it's just because the season was just enough to make the larvae flourish. Now, all these unprecedented changes as a result of climate change, and so the burden goes to the human beings, and especially affecting women and the children.
WaterAid Uganda stresses integrity among health workers and government officials, emphasizing that corruption in the healthcare system affects everyone.
We need to look at those gaps or where money is escaping through, I didn't want to use the word at first, but I can use it, through corruption tendencies. By doing that, we stop privilege, and therefore funds that have been allocated, even if we start from the Ministry of Health, which has WASH activities, Ministry of Water, which has WASH activities, in schools and education institutions where there are WASH activities, even if we stop on those first three.
Sudat Kaye, UBC News.